Like was mentioned before, I'm the Chief Data Innovation Officer at the Aga Khan University, and I've actually been doing data and AI for over 30 years. I know I look very young, I look like I'm 25, but I'm not. And what I'm here to tell you is I've been doing it for 30 years in private sector, and I have seen it deliver unimaginable value. And so what I would like to do next is walk you through the big 5 lessons that we've learned and see how we can take what is a rule and transform it into reality. So rule number 1, do not copy and paste. First of all, we know it's not going to work because it has not been built for our realities, but we also know that we have a unique situation. We have unique context. And so therefore, if we just copy and paste, we actually also inherit all of the inefficiencies. And I strongly recommend, strongly suggest, whatever word you want me to use, do not do this. Big 5 rule number 2, leverage the analytics continuum. What do I mean by that? Today, and even when we've heard many of the presentations so far, it's all about that shiny object, generative AI, predictive models, large language models, open AI, chat GPT. But we have an analytics continuum, It goes from descriptive to leveraging stats to predictive to prescriptive. And there is a lot of value in taking descriptive analytics, looking at your data, and asking the right questions. You don't have to jump to that shiny ornament. Big 5 rule number 3, look at the whole human. Look at the whole human. This is a simple rule, but I think it'll be the most transformative. And let me explain to you why. When you look at healthcare in general, I would say 99.999% consider healthcare to be those medical determinants. Your blood pressure, your glucose, your BMI, your weight, the size of the tumor, etc. But we all know that when it comes to your health profile, it's what you can't see that plays a bigger part. It's your mental health. It is your social determinants. It is your lived experiences. And I am going to strongly make a point. For us on the continent, this is going to become extremely important in the future. Big 5 rule number 4, leverage technology as an enabler. And what I mean is technology should extend our resources, our capacity. And why do I say this? In most industries, when technology has been implemented, you gain efficiencies, you gain productivity, you lower costs. We've gained those efficiencies in terms of leveraging technology. However, in healthcare, this is not always the case. I'm going to give you 2 examples. The first is cataract surgery. A doctor can actually perform 10 times more surgeries than he could 5 years ago. But guess what? The fee structure has not changed. We did not go from $2 to 10 cents. We absolutely did not. Let's look at MRIs. Technology in MRIs are so sophisticated that you can take so many more slices of information, so many more images, 10 times more images. But we still put through the same number of patients every day. There was no productivity realized. And we on the continent cannot afford to make that mistake. If we take technology and we implement it the way it has been implemented in high-income countries and redesign it for our realities, we will not gain those efficiencies. We will actually import the waste, and we do not absolutely do not have the budgets to absorb that waste. Big rule number 5, and this is my last rule, is democratize the knowledge. Democratize the knowledge. It's actually one of my favorite sayings when it comes to addressing our healthcare challenges on the continent. And what do I mean by that? In high-income countries, data is your most valuable resource. It is hoarded. Nobody gets to look at it. It is your competitive advantage. And this is absolutely not a lesson we need to repeat here. If a hospital figures out how to treat cancer better, that needs to be shared. If we understand how to deliver medicine in a more effective way or a care protocol that works to address maternal mortality, it needs to be shared. We cannot hoard, because I already walked you through 2531. We carry 25% of the global disease burden, 3% of workforce, and 1% of the financing. If we do not share, we are not going to address these challenges because we do not have enough people or money to address these. We need to share that knowledge. And so this is where Afya Gemma comes in. So Afya Gemma is actually a project that we're undertaking with google.org, and it has to do with the award that we just won. The entire vision around Afya Gemma is to be empowering frontline doctors with knowledge so that they can make an informed decision at the point of impact. And this knowledge is not just your typical, hey, let me go into ChatGPT and, let's look at it. It's the ability for that doctor to ask a question in English or Swahili, and it will go against 3 local curated Kenyan sources. The first source is guidelines. How do we treat for gestational diabetes in Kenya? These are curated guidelines based on our expertise and based on Ministry of Health guidelines. The second source is our research insights. We know it takes on average 10 years for research, 7 to 10, to translate into action. And last but not least, it's our EHR repository. So think woman walks in, doctor suspects she has gestational diabetes, not really clear what the protocol should be. And so therefore, asks a question, guidelines come back with, here are the tests you need to run in order to confirm, but latest research insights say this, and historically, this is what has worked. And so that is the vision behind Afya Gemma. From an infrastructure perspective, I'm going to call out all those in the audience. When you leverage our talent, you do not pay us Silicon Valley prices. When you leverage our talent, you do not pay us Silicon Valley salaries. Why do you think it's okay to charge us Silicon Valley prices for cloud infrastructure? Why is that okay? And so we need to make sure that as a community, we rally against this. Which brings me to my bottom line. I've shown you that leapfrogging is absolutely viable from a continent perspective. I walked you through examples that are not fiction, they are here and they are real. We walked through the big 5. It was not an academic exercise. I showed you examples of how it is in practice today. I am telling you, with 30 years of experience in data and AI, I am not 100% confident. I am 9,642% confident that we can lead. And so the art of the possible is not a moonshot. It is a possible. Thank you very much.